All right. Well, thank you, Grace, for that introduction. So yeah, I'm sure if you guys are here today, I'm pretty sure everyone in this room is probably pretty familiar or has been familiar at some point with constipation. It's a very common thing. So hopefully we can give you some good information today and get you some help for something that a lot of people struggle with but don't necessarily want to talk about. So, let's start off with who gets constipation. Like I said, probably everyone in this room has at least at one point in their life experienced some form of constipation or another. Up to 27% of Americans deal with constipation, and I would guess that number is probably higher. That's people who actually report, chronic constipation that's impacting their lives. But like I said, we all deal with it from time to time. Women are usually going to be more likely to develop constipation. We don't necessarily have a good reason why that is, but just in studies and in things that we've seen, women are definitely more likely to develop it. And then if you look down a little further, adults greater than 65 are more likely to develop constipation. So some of the age demographic we're dealing with today. So if you see there, 26% of men and 34% of women over the age of 65 report having dealt with constipation kind of as a chronic issue for them. So like I said, this is a big issue that a lot of people deal with and not a lot of people talk about. So what is constipation actually? How do we define it? It's kind of a broad term, and so this is more of a kind of medical, I guess, definition that's a little bit simplified. But we think of constipation as fewer than 3 bowel movements per week. So, the regular amount of bowel movements can vary for a lot of different people. There's no clear cut, you need to be having this many bowel movements, but if you're having less than 3 a week, it's pretty likely that you're having some constipation. Or if more than 25% of your bowel movements are pretty firm, hard, difficult to pass. So if you're having to spend a lot of time on the toilet straining, really having difficulty going, more than a quarter of the time, that would also be indicative of some constipation. So, but like I said, the normal for people can range from anywhere multiple times a day to every other day to once every 3 days. You kind of have to listen to your body as well to tell you, am I constipated? What does this look like for me? So causes of constipation. There's a lot of different causes. For the vast majority, it's going to be 1 or 2 of these, but certain medical conditions can certainly cause constipation. We'll talk a little bit about some of those. Medications can be a big culprit of constipation. We'll also talk about some of those. As we age, we generally have more medical conditions and maybe start to take some more medications. So like I said, with people over 65, that's one of the reasons it may be more common is just you're having more medications on board that do come with side effects and things like that. So for a lot of people, these next 3 are going to be a big component of why they deal with constipation. Like I said, the medical conditions and medications definitely have an impact, but lifestyle, diet, and stressors, as far as things happening in their life. Lifestyle meaning physical activity, how much people are up and moving. Diet, obviously what people are eating, putting into their bodies can have a big effect. Foods that are going to be worse or kind of be more constipating foods are going to be dairy products. So those are kind of a big culprit. Gluten or bread, wheat, white bread, rice, those types of grains can sometimes induce constipation. Red meats are ones that can cause constipation. Anything that's a little bit heavier, greasier, deep fried, kind of all that stuff is definitely something for our overall health we should probably avoid that can be constipating as well. So those are a couple of the big foods. And then obviously, that kind of goes along with fast foods and processed foods are going to be a little more constipating as well. Stressors, we know that anxiety, depression, kind of outside psychologic factors play into constipation as well. So if we're not feeling good, internally, if we're dealing with some sort of big event in our life or something that's causing a lot of stress, that does tend to manifest with, GI symptoms, constipation being one of those. Can also have, stomach pain, other things that come along with that. And then one that's pretty common that a lot of people see is travel. A lot of people, especially international travel, people tend to be constipated. You know, if you are in somewhere where you're not as familiar, where the next bathroom is, or you're eating kind of a strange diet that your body is not necessarily used to eating all the time, that can definitely have an impact on kind of your GI health. So like I said, a couple of medical conditions that are more associated with constipation. So diabetes. If you guys are familiar with, you know, people who have kind of long-standing diabetes, they can get some nerve damage, you know, typically in their feet and things like that. But it can also cause nerve damage to your GI tract, to where things just aren't, you're moving as quickly through there because the nerves aren't getting the right signals like they used to. Some of these other stuff are more related to kind of nervous system problems as well, the multiple sclerosis, Parkinson's disease, a spinal cord injury. Hypothyroidism is one that kind of controls a lot of the metabolism in our body, and so if you have a thyroid that's not putting out enough of this, this chemical to kind of regulate our metabolism, you can definitely have some constipation, as well as you'd have kind of probably some other signs as well, just fatigue, feeling not yourself, hair might fall out, some other things. And then IBS, which stands for irritable bowel syndrome, that's a disease that we don't necessarily have a pinpoint test or study or something like that. Alternating bowel function. Their bowels don't work kind of how we would expect or hope them to. You know, it's a real medical diagnosis, but it can be hard to get to that diagnosis sometimes because we kind of have to rule out a lot of other things that could be in play there. So medications, like I mentioned, that are going to be constipating. A lot of people are familiar with pain medications being the narcotic pain medications. So those have an effect on your GI tract as well. You have receptors there that will respond to those pain medications, and it'll slow everything down. So if you've ever been hospitalized for any reason and had to be on kind of stronger pain medications, I'm sure you're probably familiar with maybe some constipation that was a result of that. Certain blood pressure medications can have that effect. Antidepressants, which can kind of be tricky if you're trying to treat some of the stressors and things in your life that maybe is causing constipation. Some of those medications can also worsen constipation. Certain iron supplements, so if you are low on your red blood cells, if you're anemic, have to take something like an iron supplement every day, can cause some constipation. Seizure medications and then anti-Parkinson's disease medications can also be worse for you. So, like I said, constipation is common, and it's usually not anything that is too big of an issue. You know, it's something that obviously we want to treat and get people feeling better, but there's usually not a big kind of scary thing going on that we need to address. And so this list is kind of, when is it more than constipation, or when should my constipation prompt me kind of getting some further evaluation more than just maybe some medical therapy. So anytime, you know, you see blood in your stool, that's not normal. That's something that should kind of be a red flag for you, saying, okay, what's really going on here? Am I up to date on my colonoscopy? Do I maybe have some hemorrhoids or some other thing going on down there that I need to be addressed? Obstructive symptoms, so that's kind of symptoms with nausea, vomiting, and some abdominal distension, your belly kind of, you know, puffing out, swelling, becoming firm. That can be a sign of a small bowel obstruction. So if your intestines have a kink in them basically and things aren't able to move through, you're obviously going to feel constipated because nothing's getting past something, and then you're going to start to kind of develop these other worse symptoms as well. Usually people who have that are pretty aware that something's going on. You know, they're sick in other ways, they've got fevers, a lot of pain and stuff like that. That would kind of coincide with the acute onset of constipation. That would be more common in a small bowel obstruction. You know, severe constipation not responsive to treatment. So if you've tried a lot of over-the-counter or other therapies that we'll talk about and you're still not getting relief, you know, I think it definitely warrants coming in and getting an evaluation. Some weight loss, that it would be unintentional weight loss. You know, obviously if you're trying to lose weight, that's a good thing for you to do. But if you're losing weight without the goal of losing weight, greater than 10 pounds, that's probably something that we need to address and look into. Anytime there's a family history of colon cancer, you know, that increases your risk for having colon cancer. So we'd want to make sure you're up to date as far as your screening purposes for that. And then if you had inflammatory bowel disease, which is a pretty rare kind of autoimmune condition, but that can be a little bit more indicative of something that needs a further workup to make sure we're not missing something there. All right, so let's talk about first some easy things that you can kind of just do as far as in your own homes without maybe needing to go get an evaluation to help with constipation. So like I mentioned, a lot of times it's due to lifestyle, diet, that type of thing. So first and foremost, increasing kind of your physical activity can be very helpful. Anytime we're physically active, that also promotes activity in our gut. So our bowels and everything are constantly kind of contracting and relaxing and moving things through. So increasing your activity level is going to prompt your GI tract to do the same thing and kind of push things along faster. People who have a very sedentary lifestyle are usually more constipated. Fluid intake is important as well. You know, if you're not getting enough water, if you're not having enough fluid to kind of help soften your stool, everything's going to be pretty hard and firm. And like I mentioned before, if you're having greater than a quarter of firm, hard bowel movements, you're probably dealing with some constipation, and that can make a lot of things worse. We'll talk about in a sec. So this can be helpful if you can try and establish a regular kind of routine with your bowel movements. In talking to a lot of patients, it seems that physiologically people just kind of fall into a pattern on their own sometimes. So, you know, people be like, well, yeah, I go every morning, or I go twice a day, these times usually, I go after breakfast, or trying to get in kind of a regular pattern that your body is familiar with will help you to just kind of stay more regular and avoid constipation. So if you are struggling with constipation, this next one, trying not to spend more than 3 to 5 minutes sitting there on the toilet trying to go. So if you're going and nothing's really working, if you can't have a nice bowel movement, after 3 minutes or so, you should probably get up and move, drink some water, kind of get up and active. If you're sitting on the toilet for a long period of time, that can worsen any hemorrhoids that people may have, and those cause a variety of other symptoms. I don't know, we had our hemorrhoid talk a few weeks ago. I don't know if any of you were there for that one, but itching, bleeding, just kind of discomfort. So we want to avoid people, obviously worsening other conditions that may be going on. And like I said over here, for most people, after a meal or kind of after some physical activity will help to kind of promote having a bowel movement. Along with physical activity, if you eat something, your GI tract once again kind of goes into activity mode where it starts moving things through. It becomes a lot more active because it's getting ready to help digest your food. So after a meal can be helpful as well if you can establish that pattern. So let's talk about the management of constipation. So if these lifestyle things aren't really doing it for you, let's talk about some of the other things. First and foremost are going to be bulk forming laxatives. Now these are going to be your fiber supplements. So fiber is an important part of our diet that helps us to kind of get the appropriate amount of bulk into our stool. So if you have a diet that's low in fiber, it's likely you're going to have some constipation. And most Americans in their diet do not get enough fiber. The recommended amount would be about 30-35 grams. Most with our kind of Western diet, we're getting kind of 10 to 15. If you're eating a lot of high fiber foods, maybe you're doing a little bit better than that. But I think it's safe to say that a lot of people could benefit from a fiber supplement, especially if constipation is a concern. And it's kind of one of our first line go-tos as far as, if we've ruled out a lot of these other bad things that may be going on and you're dealing with constipation, let's try a fiber supplement. So I'll tell you guys, these are available over the counter. They work well. The powder formulations are going to be better than kind of the capsules or the gummies or the other ones you see. So the fiber ones, or the powder ones, you mix those in with 6 to 8 ounces of water and drink that down once a day. That's going to contain about 10 grams of fiber per serving. The other ones that you can get, as far as the gummies and the capsules, usually contain like 1 to 2. So to get a good amount of fiber kind of augmenting your diet, you're going to have to take, maybe 6 or more tablets a day, gummies a day, and for most people that's a little troublesome and a little difficult to do, and they just don't remember to do it. Stool softeners can be used as well. Those are kind of help to just increase the fluid content that is able to get into the stool. In a lot of studies, they don't seem to be as effective as some of these other methods, so I would try these other guys first, but if stool, I tell patients they're safe, they're good to use. If they work for you, then I say use them. Otherwise, try some of these other ones first just because they've been shown to be a little bit more effective. So the next kind of the laxatives we'll talk about are these osmotic laxatives, which basically just increase the water content in your colon. So what they do is draw water into the colon so that it's not becoming these firm, hard, difficult stools. And probably most people are familiar with Miralax or have at least heard of it. Miralax is a great laxative. It's the one that I recommend you kind of start with after fiber if you're still having trouble. If patients are still coming in and they can't seem to have a regular, normal, soft stool, and they're on a fiber supplement and we're doing some other things, you can use daily Miralax if you need to kind of have a daily bowel movement to feel better. You can even do multiple doses a day. It's safe, it's well tolerated, so it's definitely one that we recommend. These other ones kind of work in a similar mechanism of the Miralax. They're just a different type of sugar, basically. The one I want to kind of just warn people about a little bit is this milk of magnesia. So it works as well, and it's a good laxative. The problem with this one, or the one that we kind of want to be more aware of, is it has this risk of having too much magnesium. So if you're taking this too often, you can get too much magnesium in your blood, and that can cause some other heart issues and other things like that. Especially people who have kidney disease. If your kidneys aren't working as well, not able to filter, you might want to avoid using the milk of magnesia because we don't want to put you at risk for developing too much magnesia in your blood. So kind of continuing on, there's these stimulant laxatives as well. So these are also over the counter. Senecot, X-Lax are another one that's kind of familiar for most people. So these actually kind of cause your colon or your GI tract to contract or move things along faster. They work well and they work pretty quickly. The downside with these one is they can cause more side effects, that being abdominal cramping and just kind of discomfort. Because like I mentioned, if they're causing you to have contractions or almost spasms of your colon, that can be a little uncomfortable for some people. So I usually, kind of reserve those if people have failed other measures or if we're not getting the results that we would expect. And then kind of, on top of that, these are some prescription options. So, you're not going to find these over the counter, but these are good medications. So the one that I probably use the most is this Linzess. I'm not sure if anyone's heard of that or is familiar with that. It's a good medication, and it kind of has a dual effect, is that it increases water, and it also helps with some of the contractions. But it doesn't tend to have the same kind of cramping side effect as some of those stimulant laxatives. And it's available in 3 different doses, so it's kind of good that you can move up or down depending on how you feel you're having a response to it. Really very little side effects, the biggest one being some diarrhea. So basically, if it works too well, you'll kind of go a little bit too often or have some looser stools. And if that's the case, like I said, we can kind of back down or do some different options. Trulance and Amitiza are some other prescription options as well. This one works pretty well. The Amitiza has some side effects. It does cause some nausea in people, so I usually don't reserve that until we've had some other therapies, just because obviously nausea is not a fun symptom to deal with. And then lastly, we'll talk about just some opioid-induced constipation. There's some options for that. So if you're someone who, for some reason, has to take kind of chronic, long-term narcotic opioid medications, like I talked about before, those are going to cause, some constipation in a lot of people. So these are specific drugs, these are prescription as well, that would be indicated to kind of block the effects of those narcotic medications as far as inducing constipation. And then I don't have them up here, but I'm sure people are familiar with, enemas and suppositories and other things like that. So if those are needed, if you're having, especially with kind of firm stools, if you need something to help you just get the stool out to soften it right there, you can use enemas, saline enemas to help with that. You want to be a little bit more careful and not use them too frequently. If you're having to use them often, we want you to come in and kind of talk to us about it, because with kind of chronic, long-term using those enemas often, you can get a lot of irritation just up inside the lining of the colon, and that's not a very pleasant symptom to deal with and can cause some problems in the future. So if you're needing to use those often, that would be kind of an indication to go in and get some help in other ways. So that's it for our slides. I'll talk a little bit about fiber again. So like I said, fiber is kind of our first line, and I think in the little handouts you guys got, there's a list of some fiber-rich foods. So things that you're going to want to really kind of beef up on as far as your dietary intake are going to be things like beans, legumes, vegetables. Obviously, sweet potatoes have a lot of good fiber in them. Prunes have good fiber in them. So that should give you kind of a good idea of foods that can be helpful. One thing I will kind of caution people on, if either increasing fiber in their diet or using a fiber supplement, is they can sometimes cause gas and bloating initially when you start using them. So if that's the case, especially with the supplements, I would say just go low and go slow. So start out with a lower dose than recommended on the back, maybe like a teaspoon of powder as opposed to a tablespoon, and do that for some time until you are tolerating it well, and then trying up the dose and see if you're still having kind of the gassy side effects, because that can be something that people will maybe not keep taking the fiber supplement because they don't like the associated gas and bloating. But your body will get used to that in most cases and kind of regulate itself and work on it. So yeah, that's kind of a quick rundown of constipation. Hopefully that was helpful. Yeah, if anyone has questions. Yeah, so nuts do have a good amount of fiber in them. So I would say nuts are definitely one that you can eat. And there was some concern at some point with people. I don't know if you've had colonoscopies, but people have been told, oh, if I have diverticulum or these little pockets in my colon, I'm not supposed to eat nuts. That's kind of a myth. There haven't been any studies to show that that's really something you need to avoid. So yeah, I think nuts are good to kind of keep in your diet. It can be, yeah. Yeah, it's a little bit of a double-edged sword. So there's certain grains like chia seed and flax seed, which contain a lot of fiber and are good. The grains that are going to be more constipating are going to be the processed ones, like white flour, white breads, that type of thing. The whole wheat grains, like the breads that you get that are whole wheat, are going to have a better fiber component and not have maybe a side effect. Grains aren't as common to cause constipation, but they can. Yeah, so I would if you're going to kind of go that route, I would get the breads that have the whole grains, or avoid kind of the white breads and those types of things. So the most common cause of that is going to be prior surgeries. So any prior abdominal surgery, anytime you have surgery in there, you develop scar tissue that kind of attaches to the wall of the abdomen here with the intestines. So if you have these kind of abnormal bands of tissue connecting different parts of the body, and like I said, everything in there is kind of always moving around and pushing things, you can sometimes just develop a kink because of that scar tissue, and then that's something that you'd have to go in and most likely get surgery for to kind of fix that. So that would be the most common cause. Other than that, they're not typically super common, but other things that could cause it are obviously a little bit more scary, some kind of mass or something growing in there that would cause you to have an obstruction. And that would be something that obviously if we would evaluate during a colonoscopy, very rarely can colon cancer present with constipation. Sometimes that's the only symptom. People are like, well, yeah, I just feel constipated. And if you think about it, if they have some sort of mass in there growing, just blocking the inside of their colon, their stool is going to have a hard time getting past that. And so that's one of the reasons why we recommend screening for everyone. General population starts at age 50 if you have no other family history or risk factors, but anytime, like I mentioned, those red flag signs, it's a reason to maybe do that earlier. Any other questions? That's a good question. It kind of depends on your body size, weight, things like that. I say try and drink like 64 ounces a day, minimum for most people. If you're a bigger person, you can probably increase that. Most people don't drink enough water. Especially if you're dealing with constipation, try and increase your fluid intake. So do more than that and see how you do. 64 would be a good one to kind of target. And then you can increase that. Yeah. Any other questions? Great. Well, thank you guys for having me. Hopefully you guys learned some good information, and yeah.